Good afternoon. I am honored to represent the negative team in today's debate on the motion. Should genetic testing for inherited heart conditions be part of routine healthcare in African countries? While we acknowledge the tremendous potential of genomic medicine and the value of genetic testing in specific clinical situations, we firmly oppose making genetic testing for inherited heart conditions a routine component of healthcare across African countries at this time. Our position is not anti-genomics. Rather, it is based on practicality, equity, sustainability, and responsible healthcare prioritization. First, we must recognize the reality of healthcare systems across much of Africa. Many countries continue to face major public health challenges, including infectious diseases, maternal and child mortality, malnutrition, workforce shortages, and limited access to essential healthcare services. In such settings, healthcare resources are finite. Policymakers must make difficult decisions about where investments will have the greatest impact on population health. Routine genetic testing for inherited heart conditions would require substantial financial investment, yet many communities still lack access to basic cardiovascular screening, blood pressure monitoring, diagnostic imaging, and specialist care. We therefore argue that strengthening primary health care and cardiovascular prevention should take priority before introducing routine genetic testing programs. Second, routine genetic testing requires infrastructure that is not yet widely available. Successful implementation depends on accredited laboratories, sequencing technologies, bioinformatics platforms, trained genetic counselors, clinical geneticists, and secure data management systems. Unfortunately, many African countries currently face shortages in these critical areas. Without adequate infrastructure and expertise, genetic testing may lead to delayed results, inaccurate interpretation, and unequal access between urban and rural populations. Healthcare policies should be built on systems that are capable of delivering services effectively and equitably. Third, we must consider ethical, legal, and social implications. Genetic information is among the most sensitive forms of personal data. Routine testing raises important questions regarding privacy, informed consent, data protection, and potential discrimination. Many countries are still developing regulatory frameworks to protect individuals from the misuse of genetic information. Before implementing routine testing, governments must ensure that robust safeguards are in place to protect patient rights and maintain public trust. Now, let us respond directly to some of the arguments presented by the affirmative team. The affirmative team argued that early detection saves lives. We agree that early detection is important. However, routine population-wide genetic testing is not the only way to achieve early diagnosis. Risk-based screening, family history assessment, clinical examinations, and targeted testing of high-risk individuals can provide substantial benefits while using healthcare resources more efficiently. The affirmative team also argued that inherited heart conditions are underdiagnosed in Africa. While this may be true, underdiagnosis is often linked to limited healthcare access, shortages of specialists, and inadequate diagnostic services rather than the absence of genetic testing alone. Addressing these broader healthcare gaps may produce greater benefits for patients. The affirmative team suggested that routine testing is cost-effective. Yet cost-effectiveness depends on healthcare infrastructure, disease prevalence, laboratory capacity, and long-term sustainability. In many low-resource settings, there is currently insufficient evidence that routine population-wide testing would provide greater value than investments in prevention, primary care, and cardiovascular disease management. The affirmative team highlighted the benefits of family screening. We acknowledge these benefits. However, cascade testing can still be performed in families with known inherited conditions without making testing routine for the entire population. Finally, the affirmative team argued that routine testing would help build genomic capacity in Africa. We support building genomic capacity. However, capacity building should begin through strategic investments in research, workforce development, laboratory infrastructure, and targeted clinical programs. Routine implementation should follow, not precede, the establishment of these foundations. In conclusion, genetic testing for inherited heart conditions undoubtedly holds promise. However, routine implementation across African healthcare systems is currently premature. Healthcare resources are limited, infrastructure remains uneven, Ethical safeguards require strengthening, and alternative approaches may achieve greater public health impact at this stage. Therefore, we believe that genetic testing should be targeted toward high-risk individuals and families while African countries continue to strengthen healthcare systems, genomic infrastructure, and regulatory frameworks. Routine genetic testing may be an important goal for the future, but it should not yet be considered a routine component of healthcare across Africa. Thank you.